Where's Will?
Buckle your seatbelt, Dorothy.
So it's about understanding stress and overcoming depression in COVID times. Matrix Decoded. So I purposefully chose the term matrix because it is something a little confusing. Many a times we simply attribute the mental health problem or any mental issue that we are facing, we attribute it just to stress. And we somewhere believe that it doesn't require any help or anything more to do other than resolving that stress. But then there comes the part of the matrix. It's not so simple. Many a times in these times of stress, we are actually going on to develop some independent psychiatric problems like depression or anxiety disorders, which might not resolve even after the stressful experience is over. So there I call it matrix. Let's see how we can understand it. So just a reminder of the theme of matrix many years ago, and I request your attention so that with your free mind, we can decode it. Stress has become a part of our common language. It is almost a part of even Hindi language these days. So people generally trivialize it. Anything can be called as stress. But still, we need to understand a little more of its technical part. So stress is an experience of body and mind. So it's not just about your psychological problem or the stress that you face in terms of your negative thinking and other things. Even your body and as a whole, body and mind both get involved where a demanding situation comes up and your resources to cope with it or handle it are perceived as inadequate by yourself. So simply let's take example of the COVID situation. People didn't think that how the situation would be so disruptive that to deal with it, your resources, be it financial or psychological, you wouldn't be able to handle it. So there we call it as a stress. Now, why we read everywhere, we listen that COVID times are triggering stress? Because there are a lot of things which make for a good recipe of a stressful situation. First of all, to begin with, it's about uncertainty. So human mind is trained to relax in certain or a more predictable environment. But COVID situation has been so disruptive, especially in terms of financial, that is job losses, in terms of problems with incomes, as well as health related, where people are feeling uncertain on a daily basis. To add to that, an altered routine, it's simple to understand that even a disturbed sleep schedule on a regular basis can lead to a lot of stress. Then there is an infodemic of negative news. People are not able to protect themselves from this infodemic. It is pouring to them through news, through newspapers, through WhatsApp groups, through Facebook, from everywhere getting a lot of negative news about this pandemic, which we can call as a negative news infodemic. Then people are not able to socialize, especially I've taken this point, keeping in mind people of our age group, where socializing, going partying, all those things were a major stress busters. People are now have nothing to look forward to at their weekends. Then not being able to work. Although many people are working from home or working in a different mode than they used to earlier, but people are not enjoying their working as they used to before this COVID situation. And then spending a lot of time at home. This has come up with a lot of problems of its own. People are spending a lot of time with people, especially their family members. And in our age group, we see that a lot of time being spent with children, caregiving needs are increasing. Children themselves are stressed because they are not able to enjoy their lives outside, and we are spending a lot of time with them. And there are many other things which are itself increasing stress at home. And overall, we can call it as an existential anxiety. That is, the people are now questioning their day-to-day existence. They are uncertain about their future. A sense of pessimism comes often. So, in this stressful COVID situation, what kind of mental problems are we expecting? We hear a lot of things, a lot of list of problems that we can expect, but I would just like to differentiate them into two major things. That is stress-induced disorders and common mental disorders. So, what are stress-induced disorders? So, stress-induced disorders are those problems or psychological issues that crop up when you face with stress. They begin after you are in a stressful situation, and they generally resolve as the situation improves or you improve your coping skills. But then there are common mental disorders. They also generally start in a stressful situation. But what majorly differentiates them from stress-induced problems is the fact that people are continuing to have these symptoms even after that stressful situation is over, or they have reasonably learned to cope with them. So a common way of putting it would be, in this COVID situation, I am facing a lot of stress induced mental problems because I am facing a financial crunch. And what would a depressed person say? That I have faced a lot of stress when this COVID situation began. Now, more or less, the things have improved, but still, I don't know why I'm still feeling low or sad. So, this could be a easy way to understand the difference between an independent mental problem and stress-induced problems. And as the graphic shows, that depression is more about thinking of past, your guilt, your regrets, what you didn't do well, and thinking, overthinking about them. And anxiety is mostly about worrying of future. What will happen the next day? What will happen over the few days? How you will cope with your life. Now, we need to understand that stress affects both your body as well as your mind. So, first, to see what are the symptoms that people experience with stress. So, we see that many people describe stress at their mental level or what they feel in their mind, like, I'm so overwhelmed, I can't cope. I should be able to handle going out, but I just can't. I'm so snappy and irritable. I must be a really horrible person. I'm just not good enough. I should achieve more. Is everyone else except me making perfect things? I can't seem to focus as well as I keep forgetting things. But while people say these things, they generally don't attribute it to a long term mental problem. These generically can be described as overthinking. Most people in stress overthink negative things, bad sides of the situations. I won't be able to do this. Things will be very difficult in future. Hardly anybody overthinks positive things. Then there are mood swings, there's irritability. Some people experience a more or less continuous low mood, a lack of interest in previously pleasurable things, lethargy, those kind of things. Some people experience a lot of anxiety, and some people even report forgetting things, not being able to focus as symptoms of stress in their mind. Well, if we see how our body responds to stressful situations, then we need to understand that different people can have different kind of symptoms. This is a very confusing area for people because many a times we come across, let's take an example, a person who is regularly visiting a cardiologist for palpitation. He's thinking that he has a serious heart problem, he might need to go on surgery or anything. And after repeated consultations with the cardiologist, he comes to understand that these are mainly related to stress. And after this long route, people realize that they need psychological help. But that's just one side of it. Many people experience these symptoms of stress in different parts of the body. Like, let's take this graphic. Almost every part of our body can be involved due to stress, beginning from brain, where we discuss these psychological symptoms or symptoms in your mind, to your cardiovascular system or heart, blood vessels, increased blood pressure, cholesterol, stroke, those kind of things. Then in your skin, people generally say you are under a lot of stress, you look so dull, you look without any luster, your hair look brittle. Then people often complains of different kinds of aches and pains, beginning from headaches to backaches to having a cramp or a feeling of stretching, then to your gut or digestive system, where people commonly report that appetite is disturbed, or I'm not able to digest my food well, I have constipation or maybe acid, those kind of things. And then reproductive system. In reproductive system also a lot of symptoms of stress are seen. Many a times people who are seeking consultations with doctors for sexual problems, or females who don't have regular monthly cycles or problems with that, are finally diagnosed as having stress induced symptoms. And in the COVID times, one of the most important things is the immune system. So there is a very good link between your mental well-being and your body's immune system. It is often seen in many COVID advisories that you should be less stressed, you should be mentally fit so that your immune system does well. And we know that in this situation where we are still waiting for a vaccine, a lot of things are not there for treatment. So at least we need to have a good immune system, and stress or reducing it does have a role. we need to understand that how we can differentiate stress related problems from depression, which is a mental disorder, and other mental health problems, so that we can understand when to seek help or when to help others or advise them to seek help. So, generally, it is seen that stress can lead to problems of depressive symptoms or anxiety symptoms or almost any kind of mental symptom. Taking some other example than COVID, let's take example of a person who is appearing for exams. Suppose 2 days prior to exams, somebody tells him that the teacher is unhappy with you and you will fail. He would have sudden intense stress. Some people may lose their sleep completely, some may not be able to have food, some might even start thinking of harming themselves, like in a way dooming themselves before doom strikes. But these symptoms resolve as soon as the stressful situation goes. Maybe on the day of the exam, the same teacher comes and pats him on the back. I am with you, do well. Suddenly, all the symptoms are gone. So now they were so intense, depressive or anxiety kind of symptoms, but we cannot call it as a disorder. These are directly attributable to stress, and as stress resolves, these symptoms improve. But if a person in the similar situation, suppose he prepares for exam, he goes and gives the exam, even after giving the exam, he's not able to get back to his previous self, he starts remaining to self, he feels a lack of energy, not interacting with his friends, spending most of his time alone or on his mobile phone, and these symptoms go on. And someday somebody asks him, Kiar, what has changed in you? And he says, Ki, even I don't know. It all began with that exam time. I was stressed. But now, even if there is no stress, I've cleared the exam, I am not able to shake these blues. So, we need to understand that these independent problems, that is, depression as a disorder, is different from stress. And very simple markers for these are, as I have presented in the slides, that they occur after the stressful problems occur mainly after stressful events. Generally, you can identify the stressor. These problems resolve with time. No clear symptoms of either long-term depression or anxiety disorders are there. And most importantly, reactivity of symptoms to changing situation is there. That is the same guy when he was so tense about his exams. Just as soon as the teacher said that you will do well, there was a sudden change in his problem. It all vanished. So this is reactivity. But in people who develop a long-term depressive disorder, generally the reactivity is not there. What they will report is that even if I see a movie, I am not actually able to focus on that movie. It doesn't improve my mood. If I meet my friends, I generally don't speak. It doesn't improve my mood. But the person who was having depressive symptoms because of a stressful problem, he would have a lot of improvement. Just before the exam night, I went to see the movie, I felt very nice. So here we need to understand that when it's a long-term depressive disorder and not just stress, we need help. So to summarize it, when do you need help? Simply when the symptoms are severe. Even in a stress-induced situation, if the symptoms are very severe, like it's disruptive your day-to-day functioning, your relationships, your friends, your family, they're complaining you are so changed these days, it's difficult to talk to you. People may not see that. Most of the people may say he looks so normal. But if you feel a lot of distress and things are not improving by themselves or over time, and if you have ideas of self-harm or these kind of fantasies that life after death and those kind of things, then you should surely seek help or a consultation. Also, if there is a history of psychological problems in past, suppose a person has had a diagnosis of depression in past, and right now he is thinking that my symptoms are mainly due to stress, it's a red flag. They should seek help. If there is a family history, psychiatric problems or mental health issues have a heritable component, just like diabetes, heart problems, and other things. And also, people who have some long term medical conditions should also not take stress or any kind of psychological or stress related problems lightly. They should also seek help. And in the last, I would also like to discuss a little about what preventive measures can we take. Because it's not like that we are sitting ducks. some cloud will burst and rain would come over and drown us. We can do our preventive things also. So we need to see these mainly in terms of two things. That is the lifestyle. So by lifestyle, we mean intuitively or on a daily basis without thinking what we are doing in our lives and how it can protect us. Like adequate sleep. That is a good sleep hygiene. Waking up on time, feeling refreshed after a sleep. So it's very easy to understand that not just mental problems, but this kind of a lifestyle where you have a good sleep would protect you against many things. So, similarly, a balanced diet, regular meals, giving time to relationships. Because while a lot of stress comes out of relationships, but most of the stress is dissolved or absorbed in relationships. And in current times, it is also important to say what not to be done in a lifestyle. Do not use gadgets excessively on a daily basis. Because as we discussed, especially in these times of infodemic where people advertising, they have a lot of vested interest, you cannot protect yourself from all these negative informations. So better to use these gadgets, internet, mobiles judiciously because we all can understand we cannot give them up. People may choose to take alcohol socially, but what I'm emphasizing is don't use it to cope with stress. Because if it becomes one of your coping mechanisms, then it becomes a problem. You'll keep on using it. And now, what kind of a mindset can help you prevent stress and depression? So, just like lifestyle is outwardly observable things, mindset is your inward thing. So, beginning with right thinking, being mindful. Simply, according to me, mindfulness is being spontaneous, being in present, not thinking too much of past, that is being depressed, or too much of future, that is being anxious. Being in the moment. Then, right behavior. This is a very tricky thing. What is right behavior? Many people ask. Simple way of explaining is you should behave with others in the way you expect them to behave with you. Many people expect a lot from others, but generally people are not able to get that because what goes around comes around. Then anticipating stress and taking measures to overcome it. Take help of others where needed. This is needs to be reminded because in today's independent lifestyle where people are self-sufficient financially, physically, they are shy of taking help. But human contact, taking help helps a lot. And in the last, I would like to explain about two major types of coping mechanisms. So, coping is a generic term for how a person responds to a stressful situation. So, there are two main kinds of coping, as you can see in the graphic also. One is emotion focused coping, and one is problem focused coping. So, let's take, for example, a person has lost his job. Now, the problem is he is jobless. He needs to search for a job. He needs to arrange some finances to take him through this bad time. But this all cannot be done overnight. So, what will you do till then? Maybe it is a month before you get the next job. Maybe it's a year before you get the next job. Would you go on getting stressed? Would you go on developing some disorders? No. Then you can do emotion focused coping. So, emotion focused coping is like that balm. You are not actually solving the problem, but it's a healthy way of overcoming those negative emotions, like meditating, listening to music, taking bath, doing some light exercises. So, as we come to the end, I would like to summarize in very short that what we have discussed through this presentation today is that stress and mental problems, especially depression, which is a long term disorder, they need to be differentiated. Stress related problems are generally overlooked by people as they would improve with the situation. But if they don't improve, or even in these situations, if they are very severe, then you should not shy away from taking help. So, to conclude, I will say in this COVID 19 pandemic, take precautions, fight the pandemic, do everything to protect your health from social distancing to sanitization to finding options of minimizing contact while maintaining contact also socially. But also remember that it's also an infodemic. So don't be stressed about things which are actually not there, but just in this digital space. So protecting yourself from that would also relieve a lot of stress. With this, conclude my talk, and I invite any question or any discussion from our informed group. Thank you.